Welcome back to Ground Up with Natalie, where your curious mind will go on a journey to learn something new. I guarantee you'll leave this episode motivated to take action on something that inspires you, big or small. So enjoy the listen and stay for a while. Follow us. You guys know I can't have a podcast without some health and wellness going on. So today we have a true expert, Felice Chan, who is an acupuncturist and a traditional Chinese medicine practitioner. She is going to talk us through what those two things are. She's going to define them. She's going to talk about how we can ease anxiety and depression through these holistic methods. I talked to her about the science behind it and the differences between Western and Eastern medicine. She talks about tips and tricks to stay focused throughout the day and productive. And we even talk about some ways to ease your cramps. So stay tuned and definitely give this episode a listen. And I know I say this every time, but seriously, get your pen and paper out for this one. Cheers. You look so cute. Do you always dress cute for work, or you knew you were coming to a podcast episode?
I usually will dress like this, but I don't wear makeup. But I'm
nice.
today. Just a little bit of mascara.
Yeah, same. It takes me this morning. I told you I was baking a cake, and so obviously I didn't have any makeup on, and then it was 12:25, and I was like,
gotta get ready.
And I was like, shit, I'm gonna be on camera. I have to get ready. I love that you don't wear makeup to work.
Yeah. Sometimes and it's just like tinted sunscreen. Sometimes I brush my eyebrows up, but
I always brush my eyebrows up. That's a fact. Yeah. What is your favorite tinted moisturizing sunscreen?
I use the Isden photo something. It's
Okay.
like the anti-aging protection, but it's mineral sunscreen and it doesn't make me break out.
Ooh, and does it
skin.
put a white cast because the mineral?
Not really.
Okay.
Not
I love
really.
this.
Yeah, because it's tinted, so it matches your skin tone a little bit.
True. It's not like the white sunscreen.
Yeah, exactly.
Okay. I'm going to have to look that up.
Yeah, I'll send it to you.
Okay, Felice, we start every episode with the Ground Up 3. So I want to ask you, where are you from?
I'm from Hong Kong originally.
Wow.
And I moved over to the U.S. for college. I was in Maine for 4 years, lived in Boston for a couple, and then came out to L.A.
Wow. That's so cool. I want to live somewhere else that's not here for a couple years.
You travel so much.
I know.
Counts.
I know, but out of the country.
Yeah.
Okay, what was your first dream job?
It's funny, as a kid, I wanted to be a gymnastics coach because I spent a lot of my time as a gymnast. It was my first sport when I was younger. I did it for 10 years. I loved it. And then I got a little bit too tall, and my coaches were like, you can't bend certain ways. You're just too high off the ground. Yeah, I wanted to coach.
A gym coach, a gymnastics coach.
Gymnastics.
Wow.
My first Gmail is fchen gym freak. And it's still active on my Facebook. And sometimes when I FaceTime people, it still connects through my iCloud. And I always have to explain, it's gymnastics, not like gym. I'm not like a gym rat.
Right.
It's also
Gym girl.
it's an identity from years ago. But it still pops up.
I feel like that's going to be one of the questions I ask. What was your first AIM account or AOL? Because mine was SBobLovely. I'm not kidding, because I was obsessed with SpongeBob.
Oh, that's really cute.
SBobLovely at Gmail. Okay. What was your first job? You were 16 and you got a job, or maybe you weren't.
My first job, I interned at hospitals. That's what I spent my summers doing. Just shadowing doctors, watching surgeries. I knew that I wanted to be in healthcare ever since I was younger.
Okay.
And it's interesting. I think how I grew up and where I grew up, it was very educational focused, more so the drive to the West, and the West being this hierarchy and best place to get opportunities. So to leave Hong Kong and to come here for education. And that's what I did.
And that was the goal. That's the goal for most young people.
I think so. I went to an American international school. So a lot of people who were my classmates, they're all expats. All their parents came over for certain jobs. And so the trajectory was to end up in the US after for college. It was always ingrained ever since I was young, which is a little bit strange to think. Yeah.
Okay, so you knew that you wanted to work in hospitals and take care of people. What inspired you to dive into traditional Chinese medicine and acupuncture specifically?
Yeah, so I didn't start that venture until after college. It was very much Western medicine my whole life. My closest neighborhood clinic was Western It was, if you have a flu, here are medications. And to really seek out Chinese medicine, you really had to go into the city, know uncle or a doctor. So it wasn't really accessible. There's also almost a stigma against Chinese medicine growing up because the top marks, the top people in school who go to med school, they would go to the UK and they come back and it's all Western medicine. Not until recently has it shifted, especially because of COVID, where now people are recognizing and reinvigorating kind of the power of Chinese medicine. So it's interesting now that it's bigger in the West, it's becoming bigger in the East again. It's almost this shift that we're following this Western trend, but now the Western society, we're recognizing how important traditions are and how powerful it is.
So they're still wanting to follow it. They're like, okay, let's follow it again, but it's going back to traditional.
Exactly.
So if you had to explain to like a 5-year-old what traditional Chinese medicine is, aka me, how would you describe it to someone listening who has no idea what it is, as well as acupuncture? I say 5-year-old as in like just explain it in like layman's terms.
Chinese medicine, it's a holistic medicine. So it's not compartmentalized like Western medicine. It's not like, you're looking at the kidney separately, the heart, the brain. But everything is integrated. We have meridians or channels that run through our entire body. And so to address something like eye issues, right? If you have red eyes at night or blurry eyes at night, it's very much associated with the liver organ. And so you can address eye issues by using a point on the foot, which is the beginning of the liver channel. So everything is connected. And so it's almost like you're putting seemingly unrelated symptoms together and putting it into a puzzle piece. And it gives me an idea of what's happening with someone's body and the imbalances. And I'm just like, oh, okay, we're taught to really make a pattern diagnosis and a root cause of why something's happening. And so when you address the root cause, with acupuncture, with Chinese medicine, herbs, with gua sha, cupping, whatever techniques you choose, then a lot of the cascading symptoms are addressed. So it's not like, okay, you have a headache because you have hormonal imbalances, but let's address why you're having the headaches, right? That could be also being experienced as 10 other symptoms.
Okay, there's so much I want to dive into here. So I definitely want to talk about, you talked about the stigma, right, of Western medicine. And now we're kind of shifting to Eastern and believing in it. I think one thing is obviously the science, right?
Yeah.
Western is like, well, the science says this, and Eastern is almost more, I guess, how do you in your mind go, okay, this is real, this is correct? Would you label it spiritual? Is there science behind it that just Westerners haven't really looked at?
Yes, it's interesting. It's almost like comparing two parallel medicines, right? Traditional Chinese medicine is 3,000 more, right? It's 3,000 years of medicine and trial and error. But we're trying to fit into this modern paradigm where you run clinical research studies where everything is so segmented and so compartmentalized, right? Everything is so stringent with, we're going to have this many participants, this is what we're going to run, these are the points we're going to use, or these are the herbs we're going to use, and let's see how many people out of this cohort get benefits. But in reality, no one is the same, right? Person A versus person B who has anxiety or depression. We're not going to use the same needles because everyone has different environmental factors, different, emotions that are affecting their body. Everyone is very specific. And that's why Chinese medicine is so unique and special, because we look at everything you're going through. So every, selection of points or combination of points will not be the same for person A and person B.
It's almost like a tailored experience.
It's very personalized and it's individualized.
That makes sense. And so do you think that there's hope that Western is going to kind of absorb more tradition? I'm just going to say Chinese medicine from now on.
Or you can say TCM.
TCM. Do you think that we're going to absorb TCM in our practices? Is it going to be taught anywhere? Do you think it's seamlessly going to come over here?
It's so interesting because this is a discussion I have all the time in my doctoral program right now, which is very much how do we see ourselves integrating with Western science? Or it's interesting, they like to coin them biomed, but Chinese medicine is biomed. It is scientific, right? And if you want to compare it to how we run research studies, we have decades and decades of research that has fit into this paradigm of Western medicine already. But there is so much science behind what Chinese medicine is, but to develop that understanding takes time. I was in Western medicine before. I was in pre-med. I studied for the MCAT. I was very much in that box. And to shift my mindset, there's a reason why my master's program was 4 years, because it's almost a different language. You're learning, a Chinese words, which for me, I was lucky because I'm Chinese and I have some language background. But you're trying to understand this whole new mindset of what worked or what is working in the East and how to translate that to medicine here.
So since you mentioned schooling, can you talk a little bit about if someone was listening to this and they wanted to be a practitioner in TCM, what was that experience like for you?
To find a school, honestly, I just Googled, best TCM schools in the country.
Yeah.
You have to have an undergrad degree, and it's a graduate program. There's some programs that are, I think, generally between 2 to 4 years. I chose to be in California because the curriculum is much more in depth, because you don't only have to do acupuncture, you have to study herbs. And there's 400 to 500 herbs in the Materia Medica that we have to know. We have to know it by heart for exams, right? We have to know a combination of them for formulas, but also hundreds and hundreds of acupuncture points, but understanding the power of each point, but also how it works together. So it's a very creative medicine. But for school in general, any school in general is very much systemized. So you study, what is in textbooks. You study what is given to you to pass an exam to say, hey, you're credible now. You've put in this much work, so you're a good practitioner. But most of what I'm learning is in clinic right now, because that's where we get most of our hands-on experience. And in school, you also have 2 years of clinic. And that's where you start to develop your style, where you will supervise or be under supervision from other acupuncturists, and everyone practices differently. And so you start to take, little bits from each, practitioner that you follow, and you make your own style and you see what works best for you.
I feel like that's enough evidence. The fact that there's 4-year schooling at universities for TCM or colleges, whatever, that's like, okay, it's obviously a real thing that helps people and cures people.
Yeah, and at least with the program I went to Emperor's College, it's very in-depth. It covers Eastern and Western medicine.
Okay.
I was lucky that because I studied Western in undergrad, I was able to transfer a lot of my science credits. But for people, starting from scratch, a lot of people find Chinese medicine because of A, personal experience, or B, just interest in the medicine. And it's a very different medicine. It's not money driven, right? People don't choose Chinese medicine to make money. We're hustling. You leave school and if you want to start your own practice, you're a business owner. You start from scratch. You find your patients, but you're also trying to practice at the same time. It's not really the same system as Western medicine, where, you graduate from med school, you're put into residency, and you're kind of just shifted into whatever department or hospital you're going to end up. It's very different.
That's actually really fascinating. You have to put on your entrepreneurship hat and be like, all right, got my boots on. Let me bootstrap this. And I'm already in debt from college, probably.
Yeah.
Like, let me now go open, find a space that I enjoy and reach out and market yourself. All right, guys, let's take a quick break from the show to talk about our sponsor, Mastermind Media. I've been shooting with Mastermind for a few years now, and I can truly say that they have covered all of my needs within the digital space. They create logos for me, graphic designs for my journal magic. Obviously, they produce the podcast, and it looks amazing. So I love working with them, and they're offering all of my listeners 15% off. So just shoot them an email and tell them that I sent you, and you'll get the discount. All of their information can be found in the show notes below. All right, guys, back to the show. And I know you have your own clinic. How has that experience been for you to try to do that?
It's been amazing. It's everything that I've ever wanted. I remember sitting down and reflecting the other day, and I was talking to my husband. I'm like, wow, I'm happy. Like, this is where I'm supposed to be. It was challenging. After graduating, I had to study for 4 months to pass like 5 board exams. One of them was like 6 hours long. The other 4 were 2.5 hours each. And so it's just
And this is
lot.
To be an official...
Correct. So you go through 4 years of schooling that basically teach you how to pass these exams. And then you have to study an additional, 3 to 4 months to pass these exams, because it's very specific, right?
What is the official title that you get after this, or certificate?
Licensed acupuncturist, LAC. In California is, you're a licensed acupuncturist. Though there's a lot of programs that also integrate like a transitional doctorate or doctorate, where then you get a doctor title, dependent on what you choose and what path you go.
Which you're doing now.
Yes, I'm in a doctoral program. It's a transitional doctoral with Pacific College of Health and Science. They're based in San Diego, but it's an online program and it's great. That's where they really teach you how to integrate with the Western modality of science, how to speak with doctors, how to be the best you can for patients and work in an integrative setting.
It's like the next level. You went all the way through.
Yeah.
Okay, so acupuncture, can you explain that as if you're talking to a 5-year-old?
Yeah, of course.
Yeah. What is it?
So acupuncture is where you place needles in around the body. You know, you puncture the skin and you're basically activating like energy wells. So you choose specific needles to activate energy wells and send what we call chi towards certain parts of our body, or chi's or energy. It's our vital force. It's what gives us just everything, right? Without chi, you don't exist. And so with these needles, when we activate certain points, all of your energy is rushing there. And you can almost think about certain points will do certain different things for the body. It could tonify your blood. It could, reduce stagnations. It's very powerful. Yeah.
And then herbs as well. So you have someone come into your office, they get an acupuncture session. Let's do something specific right now. Let's say someone came in because they're dealing with, first we'll do an emotion and then I'll go into like a physical pain. So someone's coming in, they have a lot of anxiety, anxiety attacks, panic attacks. They don't know what's going on. They've gone to every office, they've taken every pill. Finally, they find Dr. Felice Chan and they come get a session with you. What's the first thing that you're going to do and go into?
Yeah.
I know that they're a specific person, so you're going to be like, how much do you weigh? Like, where do you live? Do you have cats? And all of that stuff. But maybe a more general.
Yeah. I mean, in general, I always like to spend at least 20 to 30 minutes in the beginning of a session asking them everything. Before they come in, they'll fill out an intake form that gives me a really good idea of what's happening in the body, but it's very, very thorough. It's everything about their energy, their sleep, their stools, what they eat, what symptoms they're experiencing from, headaches, dry eyes, eczema, asthma, like whatever history they have. I want to know their whole picture and their whole diagnosis. And so we spend about half an hour really diving deep into, can you tell me about when this started? Can you tell me about, how you hold your stress? Do you have any decompression techniques? Do you meditate? Do you breathe? I'm going to ask them some strange questions, for example, like, do you get lightheaded when you stand up? Do you have thirst? Do you have dry nails? All of that is very indicative of the temperature in their body, their fluid intake, and it gives me an understanding of why they have anxiety. And after that, that's when I do some, vitals. I check their blood pressure, get their temperature, their oxygen, just to make sure that everything is good. And then a lot of what I do is palpation diagnosis. I think what's really important with acupuncture and Chinese medicine is we need to feel the body. In Western
Is that what
medicine,
palpation is?
Yeah, palpation.
Feeling the body.
Exactly.
Okay.
Because that's where you can really feel where there's imbalances. There's not much you can do. I mean, with seeing, there's so much you can see with the color of someone's eyes, their tongue, you feel their pulse, which is all Chinese medicine diagnosis, is so important. I love to read at someone's tongue. You can see their entire internal imbalance just with their tongue. You have a whole organ map on your tongue.
What?
And then with the feeling of your pulse, it's not just like the rate, but it's how we have strange words like wiry, slippery, bounding.
What does a healthy tongue look like?
A pink, moist tongue. But I rarely see a healthy tongue because we're human, right? And we eat things, we have emotions, and emotions are one of the biggest things of imbalance. And it's amazing that we feel these emotions, but they put our body off balance.
I just got a tongue scraper. Is that good?
In Chinese medicine, I mean, it's not bad. It's just when someone scrapes their tongue, I can't see what's happening on their tongue because tongue coating is really important. Yes, we have the color of the body itself, but tongue coating is what also we see what's happening in the gut, what's happening inside here. So like a healthy tongue is like a thin white coat, but if it's thicker, it kind of indicates more damp. If it's yellow, there's some heat. Some people could have no tongue coating and means that they're lacking in something.
Wow. Something as in
it could be
love or as in like a nutritional deficit?
It could be that too. For example, people who are deficient in B12, They don't have a little like papillae or little like bumps on the tongue.
Okay.
Yeah, it shows so much.
It makes sense, the schooling now, for real. Because if you're getting an intake form and it says all of these specific things, oh, well, diabetes runs in my family. And, yeah, I saw your post the other day. My hands are cold. My feet are cold. Like all of these specific things. And you have to know what all of that means together. So it is so, so tailored. That's amazing. I would feel so I have to still come see you. But I feel like if I went to your clinic, or I'm sure any acupuncturist, I would just feel very seen and like they knew the whole picture. Because I feel like when you go and get your checkup at the doctor's office, they're like, when's the last time you had sex? And it's like, why does it matter?
Why does it matter? Yeah.
Maybe that's one question, but you're not asking me anything else. It's just like, very impersonal.
Yeah.
I
Oh,
think that's
definitely.
the problem with Western medicine is they do not get the whole picture of who you are at all.
Yeah. And I think that's why Chinese medicine is so beneficial. We're really understanding the whole body as a whole. It's a holistic medicine. And if we don't ask these questions, we're not going to understand what is connected. We're not going to understand what imbalances are happening in the body. So it's a lot of talking in the beginning. I had a patient actually yesterday, and she was like, you're kind of like a psychologist. You just listen. I was like, I have to, and it's my job. It's my profession. I love it. This is what brings me joy. Yeah.
Yeah, I'm sure they feel good leaving just because of feeling seen and like knowing that something's in the works, that they are being taken care of, and that they got it all on the table.
Yeah.
They're like, all right, here's what's really going on in my life, because you go through everything, emotional and physical.
Yeah. And it's also interesting, I mean, with this medicine, because we're basically bringing everything out of balance back into balance the best way, so then they don't feel these symptoms. It takes time. I mean, it's a natural medicine. You're activating what your body already has with these needles. You're not putting extra drugs in. You're not injecting yourself with anything, but you're just creating movement. And then you also pair these treatments with herbs, which makes it so much more powerful. Because if someone is lacking, let's say someone's anemic per Western standpoint, we say is very much blood deficient. Most women are anyways, because we have menstrual cycles and we lose blood. We don't learn how to replenish it ever. And so over time, as we get older, we're going to be more and more blood deficient. And so sometimes we need the herbs, or we need nutrition. Everything goes down to what we eat, how clean it is, the quality of food. Because even with that, like, clean eating, clean living will heal you from inside out.
Yeah. From a Chinese medicine standpoint, what do you think is the healthiest type of diet?
Ooh, I like talking about this a lot because it's all relevant to the spleen. So our spleen is such an important organ in Chinese medicine because it's the organ that receives the food. It transports and transforms the food and fluids. We're warm-blooded animals, and so warm foods are the best, warm and cooked, nourishing foods. When we think about anything cold, it kind of puts your spleen on overdrive. It needs to warm up the food before it can process any of it. And so over time, if you're putting something cold, let's say you drink smoothies every single day, it's going to weaken your digestion over time. And I see a lot of patients who have smoothies and salads every single day, and their presentation, it's very damp because the spleen isn't able to transport the fluids that it's supposed to be doing at its most optimal function or form. Yeah. Interesting.
That is so fascinating. Yeah, I'm just gonna be warming up my cereal every day. No, I'm just kidding. I don't eat cereal. That's bad for you. Sugar. Does acupuncture hurt?
It's interesting. I actually had a friend reach out. It was just like, it was painful for me. The thing is, yes and no. The needles, I wish I had one. I usually put some in my purse. I should have had one, but they're so thin. They're, basically hair thin. You could fit 20 to 30 acupuncture needles into a hypodermic needle, which is what you use for injections.
Oh, wow.
Yeah, tiny. And so they basically are there just to activate this qi. Some people feel it, some people don't. Sometimes on points where you need it, it's going to be more sore. If you're coming in for something orthopedic related or for pain, it's going to be more painful because we're getting into the muscle as well. But usually, we almost say that when a needle is put into your body, you're going to feel a qi sensation. It could feel a little bit itchy, which is kind of like a histamine reaction, which is great because it's getting things moving. It could feel a little bit warm. It could feel a little spicy at first, but it always should dissipate. If anything is like a shooting, zinging pain, you could be hitting a nerve, which doesn't really happen. If, you go to a trained acupuncturist, we know where things are. We know how to avoid things, But no, I mean, I crave it all the time. I can put needles in myself. It's totally fine.
Yeah. Overall, acupuncture is very safe.
Yes.
I've read.
Yeah. It's very, very safe.
That's why it's natural.
Yeah.
Okay, so will you walk me through where we would put some needles if you were having a lot of cramps or bad pains during that time of the month?
Yeah. So it's interesting. I mean, we first have to understand why you're having these bad pains. You know, do you have too much heat in your body? Is it causing some type of inflammation? From a Western standpoint, are you cold? A lot of women, we have like a cold womb because we eat cold things. You know, we like salads and we're not really protecting it now a lot. And I mean, in LA, we wear crop tops, workout outfits, and we're not really protecting this central part of our body. And when things are cold, imagine ice in water. Ice congeals when it's cold. And that's what's happening to our body. Like when we are menstruating, our blood is congealing, our muscles are cramping because it's so cold. And so we have to warm it up. And so there's certain points on the body that are very warming and invigorating. There's certain like reflex points on the spleen channel in your inner leg or on your feet that I'll also put in just to release it right away. What I do is, abdominal palpation and diagnosis. And if there's any tenderness, or as a practitioner, I can feel almost like nodules underneath like the belly, especially in the lower abdomen. And there's certain points that, we'll put in and immediately it dissipates just because it's moving. It's moving everything.
That's why we put heating pads.
Exactly. And why it feels good.
Yeah, it feels so good. It dissipates like the pain.
Yeah.
Or a bath.
Exactly.
Oh my God. When I used to run a lot, and 3 out of 5 times I would run, I would get these cramps in my stomach really bad. And I would be 3 miles out from my house and I would be buckled over on the side of the road. One time I had to take an Uber home and it was so bad, just on the floor, like, and I never knew what it was. And I would literally crawl to the bath, turn it on, wait till it gets like really hot, get in, and whatever these cramps were, they went away. I think it was because I would go in the morning on a run before I had eaten or drinking anything, and I wasn't hydrated enough from the day before. I don't know if that's...
It's all relevant. We have like a saying in Chinese medicine where heat is your friend, because there's also another Chinese saying where, if there's stagnation, meaning anything that's stuck, whether it's your qi, whether it's your blood, whether it's your muscles, whenever there is this stagnation, that's when pathologies and issues happen. But when there's free flow of qi or free flow of blood, that's when you're at your healthiest. And what helps movement is heat, right? Heating pads, keeping yourself warm, wearing a scarf when it's windy, and also wearing socks when you're menstruating, because we have so many important channels that start in our feet that go up into our uterus. And so if your feet are cold, your uterus is going to be cold. Yeah.
I read something that said if you wear socks to bed, you'll sleep better.
I think it's really dependent because everyone's individualized
Okay.
and whether they need it, right?
Yeah. Are they hot? Then they don't need it.
Yeah. And it's fine. Like, are your blankets warm?
Right.
Right.
You said something about that. You said if our hands and feet are often cold, then you're storing some emotions inside that you won't let out, whether that's anger, sadness, and my hands and feet are always cold. And so when I heard you say that, it was so fascinating because I also keep my emotions inside. And I was like, it's one of those things you see and you're like, oh my God, that's so true. Like, it must be true. It happens to me. So can you explain that a little bit further?
Yeah, of course. So, cold hands and cold feet, we have a few or various like root causes, but one of them we say is called a liver qi stagnation. The liver organ in Chinese medicine is very much in charge of our emotions, our anger, our stress, our frustrations. And so when we experience any of these emotions, which happen on the daily for most people, it kind of puts the liver off balance and creates almost like a stagnation where it's stuck in the center. And you can almost equivalent that to us not breathing into our diaphragm, right? When people are anxious, when we're frustrated, we're keeping everything is elevated. Nothing is really going through the body. And so when you're not activating this diaphragm, the organs are not massaged in the right way and everything gets stuck. And so there's no flow through the body. That's why, needles are or acupuncture is so important and very effective for, let's say, emotional issues or liver qi stagnation, because you can put, we say points on the hands, on the feet, they're called, the 4 gates. It's very moving, and right away, like, people will feel that their emotions will start to balance out.
Really? Oh, this is actually a fun question. Okay, so relating to acting, let's say
yeah.
I needed to cry on set. Is there something I could press in my hands or my feet that can bring up tears?
I think it would make it harder for you to bring up tears because it's trying to balance you out. Yeah.
So even if it were to move some emotions inside.
Well, I mean, it could. Let's say someone is experiencing grief and holding it in, right? And the lungs are very much the organ of grief. And you put some needles in that activate the lungs. I've had patients on the table completely just like bawl, and they need to release it. So it does go both ways.
So does Chinese medicine believe that keeping emotions in can create dis-ease in the body, which creates disease?
Yeah. I remember in the beginning of my program, there was a text given to me, and it was very much like, all pathologies start from emotional imbalance. We are human. It's amazing to be human. And what's special about being human is that we experience a spectrum of emotions, right? But every emotion we feel causes movement in our body. Not to say, all the lighter emotions like happiness, joy, contentment, whatever it is, it's all great, but you can also experience that in overabundance. And it can still, for example, the heart is our organ of joy. And if we're always happy, always excited, too stimulated, it could put the heart off balance and you start to feel palpitations, you might start to have like crazy dreams at night, whatever it is.
So you want to feel them all and let them go through you. It's not about
Exactly.
sitting in the, sadness or depression, but it's letting it flow through you. So if you have resentment towards someone, it's really important to let that flow through you and get that out, or it's going to turn into, and it's so, I feel like it must be pretty invisible. You don't know at the time, right? You're like,
Of course.
no, I don't care that my mom left me when I was like, it's fine, whatever. I never really knew her, and I've already been through it. I cried when I was a kid, whatever, push. And then it's like, it's still in there because you haven't properly let it come out.
I mean, it's interesting. I mean, that reminds me of a couple things. I mean, first of all, a lot of what we see in Chinese medicine, it's kind of intangible to the human eye, right? I mean, as humans, we have our 5 senses, but there's so much in this world that we can't perceive. But you can learn it. You can learn it by trying to diagnose and understanding someone. And it's really like working with, these intangible things per Western science and really making sense of it. And that's why it's beautiful.
What do you see in the future landscape with TCM and Western medicine?
I think my dream one day is to have a TCM specific hospital in the US. I would love to see it. Whether I'm the one who helps like promote it, who knows? I don't know if I have that bandwidth or that energy to be in politics.
Oh,
yeah. I was like, I'm not a politician, but I can, be someone who's, helping along the way. But over COVID, Hong Kong opened their first Chinese medicine hospital.
Then it's definitely possible.
I mean, there's a lot in China, a lot in Taiwan, but also the US, it's its whole other beast with insurance and how Western medicine is driven. It's very much pharmaceutical driven. It's very much money driven. And you don't see that in a lot of other places in the world. And so to kind of break through that gap, how is that possible?
Because right now, would you say that it's kind of, what's the word? Like you have to be privileged to get traditional Chinese medicine help and acupuncture?
Yes and no. There are a lot of clinics that do take insurance, like let's say Medicare or whatever insurance that, the practitioner will apply for to get certain patients and be under the referral program.
Okay.
Personally, I chose not to do it because I didn't want to spend a lot of my early days being an acupuncturist dealing with paperwork. It's not how I want to spend my time. Not to say that you can't be successful taking insurance, right? I mean, you just have to really figure out the niche. You do get more patients right off the bat. Maybe you don't get paid as much as an acupuncturist initially, but maybe later. It's a whole system that we're also fighting. For example, chiropractors will take a 3-day course to dry needle and to use acupuncture needles, and they'll get paid, 3 times as much as an acupuncturist who goes through 4 years of schooling. So it's a whole political battle. They always talk about how we need, to lobby, and it's really important. My bandwidth is not there yet. Maybe one day. Yeah.
Is there a badge that we should be looking for on when we're going to look for this treatment? Let's say it's a chiropractor or we find a practitioner that we should be looking for as a patient going to find an acupuncturist or someone that studies TCM that you would be like, yep, they're good.
Yeah. So, I mean, there's overarching acupuncture associations like per state, also nationwide. California is like one of the only states that has its own overseeing board, hence why like California has its own exams. And so everyone who does go through the education that I went through will be listed under the, Acupuncture Board of California, or all the other states are under the national board. And I also took exams for the national board in case I go to another state in the future to just make it more seamless. And I will be listed on their website.
Okay.
Yeah, but it's pretty hard. I mean, to understand like LAC versus, the doctor, the DAC, like what does it mean? They're all just letters.
Right.
But the best way is to really find a practitioner that's listed under the acupuncture board.
The acupuncture board. Okay. Good to know. So you're a very healthy person. I would like to know what is it, some of your daily habits that incorporate something that maybe someone who doesn't know anything about TCM would do.
Yeah. I always put warmth in my body first thing in the morning. Warm lemon water is my favorite. I mean, from a Western standpoint, it just kind of invigorates your digestion, but also warmth is so important to awaken your spleen and digestion in the morning. I always encourage breakfasts. I know that, there's a whole trend of fasting, not to say it's not great, but some people are not built for fasting. If you already have a weaker digestion, fasting is going to make you weaker. It's going to create a lot of other symptoms. Again, very individualistic, but always suggest to eat breakfast, a protein-rich breakfast. We want protein in the morning.
Not sugar, not reaching for...
Yeah, fruit, sugar, or even just like carbs. You always need to like coat your carbs or have, good fats, good protein. You can have carbs too, but you need something that'll kind of hold down your blood glucose levels so they don't spike and create, blood sugar crashes later.
Yes, I've learned so much. I've heard about this. It's like coating your carbs. Can you explain that a little bit?
Yeah. I mean, when you think about, I'm trying to think, okay, let's say the first thing you put in your body, you drink a whole thing of coconut water. It's going to go straight to your bloodstream, and you're not putting anything in your body before that to help hold down that sugar. But let's say you have a few nuts, you have protein. Let's say you have a handful of walnuts before drinking a bottle of coconut water. There's a lot of research and charts that show like the glucose spike just kind of levels out, because you have this protein to hold you down. And with good fats, like high in omega-3s, whether it's like fish, avocados, olive oil, whatever it is, that will also pair well to holding down the glucose.
A bowl of cereal isn't the best thing because that's straight sugar.
Yeah. I mean, also it depends like what cereal you're eating.
Well, yeah.
I haven't eaten cereal in like 6 years, to be honest. Mostly have eggs if I want,
I asked that for my mom because she always eats cereal. And I'm like, don't put, and she's getting like, Kellogg's or whatever. I'm like, trust me. I've read about this stuff.
Yeah.
Put something. So like a carb is a piece of toast and then peanut butter is the protein.
It could be. I would, I mean, peanut butter is, it's great protein, but also where are you getting the peanut butter? But
like almond butter, organic. It's only almonds and salt.
I would prefer like a wholer type of
Tell me.
protein. Like if you can have like a boiled egg with that or avocado on top.
Yes. Okay.
Yeah. And when you think about it, just like the more whole foods or even like eating peanuts versus peanut butter is very different in how your body processes it, whole right? Foods. Because peanut butter is already ground up. You're already skipping that process your digestion is supposed to do. You like need to chew.
Yeah, chew it. It's fascinating. Okay, so you have lemon water. Are there any other self-care tips that Sally Smith can incorporate in their daily routine that you think that can, just curb, I feel like we're in an age of anxiety-filled things happening around us, whether that's social media all day or comparison or all these things. And I feel like anytime I take just 30 minutes of journaling, like that would be my self-care tip, of like just to myself. It's so helpful. So what would you say?
I think like my one non-negotiable is finding some time throughout the day to practice any type of mindfulness, whether it's journaling for you, whether it's going for a walk, whether it's meditating, whether it's breath work, because it's so important for our nervous system to reset that way. It's how in Chinese medicine our qi starts to balance. If we are experiencing this liver qi stagnation that I mentioned earlier, with meditation it starts to dissipate. You're starting to breathe again. Everything's starting to move. And when you're able to reset your nervous system, your body is able to heal. You're able to sleep better. That's where health comes from and longevity, right? When your nervous system is at this parasympathetic rest and digest state as much as you can.
Yeah, I couldn't agree more. When I go on a 30-minute walk, I'm like, oh my gosh, my day has just gotten so much better. And you feel a little bit of a sweat and you're outside and you're seeing nature. And I always listen to a podcast, which I'm learning. So you have clients coming in all week. Do you have any like really common questions that you get all the time? Or is it pretty personalized and like very specific?
For the most part, it's specific because everyone comes in for a different issue. But if it's like general questions about what is Chinese medicine, what is acupuncture, I think a lot of people, I always like to preface that it takes time, right? That it's compounding treatments. It's almost like, I don't like to compare it this way, but it's like finishing a round of antibiotics. If you don't finish the 10 days, you're not going to get the full benefits. Acupuncture is the same way. Let's say I see someone, I'm like, okay, I think you need to come in between 8 and 10 times, sometimes even more, 12 to 16, depending how chronic it is. It's going to take more time to fix this. And consistency is key because, they come in, they're over here. Let's say their baseline is lowered. Every time they come in for a treatment, it rises a little bit. The way that we can wrap our head around it in a Western standpoint, our neurotransmitters are firing, our endogenous opioids are firing, and it kind of stays fired for like 2 to 3 days. Hence why people have this like acu high, why their pain subsides after a few days. But over time, it's going to go down a little bit, right? But the more they come back, it's just going to keep elevating. And the more times they stack it, then you're going to get to this new baseline where your body will stay at that higher baseline. And then you just have to come in for, tune-ups once a month, whatever you want, right? And some people are pretty religious about it, and they're just like, this is my self-care. This is how I meditate, because acupuncture puts your brain into a very meditative state, first of all. It fires all these neurotransmitters, and serotonin, dopamine makes you feel good. And it's also a nervous system reset. It's naturally a sedating treatment. And so needles are so powerful at switching your nervous system from like this crazy sympathetic to the parasympathetic.
If someone had a lot of migraines, what would you say? Can you show us the pressure points that you would say, like a quick fix?
Yes and no, because
that's a big one.
So many people experience it, but what is your trigger, right? What is the root cause of your migraines? I'll give like 2 examples.
And this is the difference between Western and Eastern, right?
There's no one cure for all.
Yeah, because Western would be like, you go to the doctors because you have a migraine.
Yeah, take an Advil. It'll just, it just basically blocks your pain receptors. It's a Band-Aid.
Or they'll give you, prescription, right? And they don't know anything about you. You have this migraine, but that's saying that all 200 people that went into that office that week that had migraines are the same person, and that it's going to fix them. That's almost doesn't make sense at all to me.
Yeah, exactly. And, the 2 examples. So let's say there's a woman who's anemic, who's blood deficient, who probably B12 deficient if they're fatigued and tired. They're thirsty, they have blurry vision, they're a little bit weak. They have light, scanty periods. Maybe their cycle isn't regular. I would say the headaches are very much caused by a blood deficiency, we say. There's not enough substance in their blood to kind of flow through, and hence like why someone could have worse headaches after your period or after your cycle. So that's one example. And so my goal with them is to boost their blood, and there's certain points on the body that will boost the blood. I'll also probably encourage them to eat clean red meat, grass-fed, grass-finished, to drink bone broth after their periods. So that's case 1. Case 2 could be, you're getting headaches because we say something called like a liver yang rising. Our liver, again, is like our frustration or anger. And when there's too much heat, which is yang in Chinese medicine, or a portion of what yang is, everything rises in our body. Just like in nature, heat rises, it does so in our body. And that's what's causing the headache. It could be a more stabbing, intense headache. And you feel it when you're angry. Your neck gets tense, your face gets red, your eyes get red, you're volatile. That's another type of presentation you see with this headache. So why are you getting the headache? And so there are some points that are generally great, some on the head, between the eyes, by our temples, even behind our neck, some of our feet that help drag down a lot of the pressure that's over here. But in general, it's so individualistic.
I would assume that you would want to get yourself in a state of like calm to do those things, right? You know, just be like, oh, why isn't this working? Like rubbing your temples, but it's almost a meditative thing. You're like, okay, I don't feel well right now. You stop, let me breathe, like you said, through
The diaphragm, yeah.
the diaphragm, and do this ritual to see, what happens. I mean, I would assume that it would, go down a little bit at least. And I feel like we underestimate that because we are such a fast-paced society. Okay, well, let me call the doctors and make an appointment.
Yep.
I don't have time. And it's like, if you took all that time that you were just, complaining about that thing or calling the doctor's office or whatever, to just sit for an hour without your phone, light a candle, and breathe, I think people would be quite shocked at how
impactful it is. Yeah, for sure.
how calm they feel.
Yeah. I think, yes, being in this fast-paced society, everyone's trying to be productive or trying to make a living. But, there's so much productivity in being non-productive, right? For your health.
Yeah.
Yeah.
I'm definitely guilty of that.
Me too.
Yeah. We literally live in it. One of the most interesting things that I've been going through is I used to be able to read a book in the morning, not a whole book, but like for an hour. And it's just dwindled down, 45 minutes, 30 minutes. Now I can hardly sit for 15 minutes and read a book. And that's with me wanting to work on it too. And I'm like, oh my gosh, okay, well, I'm really excited. I want to work on the podcast now. And like, it's good to be excited about things. But at the same time, it's like, why are you rushing to go and do this thing that you have all day to do?
Yeah.
Why is it? That's why it's so hard to meditate and do those things. But the benefits are, I feel, huge.
Yeah. And I mean, it's the whole premise of what TCM is, right? It's a lifestyle. It's about balance. Everything is about balance. You have the yin and yang circle picture, right? Everything is intertwined, right? You can't exist without one or the other. But it's really like finding that center where you find where you are the most grounded to really return to at the end of the day. That is so important because yes, you can be fast paced. Yes, you can be very productive, but you also have to find the balance of the opposite to be like the healthiest wellness person you can be.
And what is your take on social media and the phones these days with stress and depression and, the, I guess a little off topic, but the suicide rate in young women is through the roof right now, and like 13-year-old girls. And so what do we do about that? Like, what do you think?
Oh gosh,
from a holistic standpoint,
I mean, I go through my own battles with social media too, just being very active on there. But I do, it's draining. You're vibrating in a different frequency when you are on social media, right? Comparing yourself versus if you're sitting by yourself in nature, you're at a whole different frequency that is so much more healing for the body. And what you do is what you attract. It's hard, especially younger girls who have constant stimulation of comparison of these girls look this way, right? But also social media is such a snippet of how someone looks like, how they live. People edit their videos all the time, edit their pictures. And so when young girls are on social media and they see, this beautiful woman thriving and they're not, it's debilitating. It's hard. And hence why I think it's so important to just really show what someone who is young can do to balance their lifestyle, to say, okay, this is what you see. It's probably unrealistic and it's fine. Like, who you are at this moment is who you're supposed to be, right? You're supposed to be at this place and this time to learn something, to just be present. I guess my solution, like as a holistic practitioner, just make sure you have days where you're not on social media. Make sure that you are pretty strict with it. You can set timers on, your computer, on your phone, to not be on it, and just carve out time to be in nature.
And I think what comes to you in those moments of silence too is that voice inside of you that's like, hey, you don't need to compare yourself to that person, and just like that voice of creativity and reason within you and that loving part of you. I feel like only or comes out more often when you are like taking care of yourself on those walks. And the opposite voice comes out when you're scrolling through social media.
Yeah.
Yeah, I just wanted to ask you about that, and I
Yeah.
loved your answer. I thought that was beautiful. It's become and we're just progressing in the opposite direction. I think that you and I would like, and I feel like as two people who are on social media, we also get lost in it as well.
Oh,
So it's
totally.
like fascinating to have this point of view and understand how detrimental it can be, while also partake, but also creating healthy habits like
Yeah,
around
absolutely.
being on it.
Exactly. All about balance.
Yep. Seriously. I love that. Is there anything that I didn't ask you that you're like, ooh, I wanted to like touch on this. I think people would like to hear this about TCM or acupuncture.
I think a lot of people are curious about like how to find a practitioner, right? And how to start their journey. It can be pretty daunting because it's a very unfamiliar medicine. You know, it's not like, I'm going to Google or go through my insurance. If, you want to see a practitioner that isn't covered, right? You want referrals. It's sometimes hard. You just have to start somewhere. Just start asking, start doing your research. There's so many great, Instagram accounts out there who are very informative. There's people like me you can ask. It's definitely overwhelming, but it's a very, very great addition to, creating a holistic wellness lifestyle. I mean, I crave acupuncture daily. It's not not that I get it daily. I wish, in this perfect world. But it's very important. It's what keeps me grounded. If I need, I will put needles in myself, give me treatment.
That's a great addition, because I'm sure people are going to listen to this and be like, okay, that's actually perfect thing to end the episode, because they're probably like, I want to set up an appointment. And so I need to set up an appointment. So I'm going to do that right after this. Thank you so much for coming on. I love you, and you inspire me every single day to be
Likewise.
a healthier version of myself. And thank you.